You are watching the latest edition of the Wellness Hour. I'm Randy Alvarez. My first guest is a cosmetic dentist that is getting amazing results with his patients. Today's topic is what's new in cosmetic dentistry. If you want to improve your smile, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour. I'm Randy Alvarez. My first guest is Dr. Orland Davenport. Dr. Davenport is the founder of Aesthetic Dentistry of Orland Park. Dr. Davenport is a 1983 graduate of University of Illinois School of Dentistry, as well as a graduate of both the Las Vegas Institute of Advanced Dental Studies and the Pacific Aesthetic Continuum in San Francisco. He is a member of numerous dental associations, including the Academy of Cosmetic Dentistry. Dr. Davenport, welcome to the show.
My pleasure, Randy.
Now, today's topic is what's new in cosmetic dentistry. How long have you been involved?
Well, I think as a dentist in general, we're always involved in cosmetic dentistry. I mean, we've always tried to make our patients smile, look the best, do the best that we could. But in the 1980s, early on in my career, we just didn't have the materials to do that. As a dentist, obviously, we're involved mainly in function. We want everything we put in your mouth to function. We want to last a long time. Mm-hmm. However, we did not have the technology, we did not have the materials, we did not have the cements, the adhesive stuff to actually pull that off. Where if I did a case on you in 1980 with materials we had then, we would probably already replaced it by now. But I started getting involved in it more in the 1990s when we kind of turned the corner in the technology field.
How so?
Well, in the early 1990s, we started getting more materials that were being developed that could withstand the forces in the mouth. So you got to understand that a lot of the materials that we use are glass-like, porcelain. And, you know, in the mouth, like in the very back of your mouth,
sure,
you're probably putting about at least 300 pounds per square inch when you bite down into something.
Okay.
So you got to think about, if we're putting a piece of glass back there and we're biting that kind of force on, we have to have something that can withstand that force. And before really early 1990s, we didn't have that. So in the 1990s, that's when I started getting more involved because we knew we had something that was going to work. The technology was way better. The materials were way better. The labs were getting educated. One thing I realized early on, though, was that just because the technology got better didn't mean necessarily that I can do excellent work. And once I realized that, I became a consummate continuing education follower.
Sure, in my notes, Las Vegas Institute, known worldwide for their cosmetic school.
Correct.
Or for their advanced training. Tell me what you learned there. I mean, you're already an established dentist, and then you decide to go get this extra education. Tell me what that does for your practice.
Well, I think as a dentist, we really hadn't gotten to the point where we're doing smile design cases. We almost have to retrain ourselves on how we look at someone's smile. I mean, in the past, we looked at it as trying to replace teeth. We tried to make it look better. We always tried to do that. But now, all of a sudden, we're having the opportunity with porcelain veneers, for instance, that we can actually take and create a whole new smile for the patient. For instance, in Las Vegas Aesthetics, we learned how to do the upper 10 teeth, all right? Mm-hmm. Which is the whole smile. So if you were to smile, what are you going to see? Usually, you're going to see the front 10 teeth.
Right.
Right. So that gave me the opportunity to meet some mentors in this area. Some of these guys have kind of gone down the road in the forefront of cosmetic dentistry before us, and they were doing it in the 80s, but they didn't have the materials that could last like we were getting in the 1990s. So I felt like I really had to re-educate myself.
Okay. How much of this, and we're going to talk about veneers today and all
Sure.
aspects of cosmetic dentistry, you know, with the materials, the natural look, but how much is artistry? Because we've talked a lot off camera, and you place a lot of emphasis on you being an artist.
Correct.
Designing the mouth, you call it. In fact, designing the smile.
Correct.
How much is artistry? How much is just technical skill or training?
Well, I think the way it is right now, I mean, technically, we learn how to do stuff in dental school.
So would you say 20%? I mean, put a percentage on it.
I would say maybe 20% technical, 80% artistry.
Is that right?
Yes. Yes. I mean, there's more involved in it than just, there's more involved in just getting the teeth ready and putting veneers on. You have to know, you have to have the end in mind before you even do that.
Let's begin then with cosmetic dentistry? What is considered cosmetic dentistry?
Well, I think in my practice, everything is cosmetic. I mean, it could be from the smallest filling that you do in the mouth, where we make a natural tooth-colored filling, or it could be a complete smile design. I mean, one of the things that a lot of people see nowadays is in extreme makeovers on TV,
Sure.
where you're taking someone and you're creating them a brand new smile. Right? So cosmetic dentistry is everything from the smallest filling to an extreme case like that. I mean, we can do teeth that are chipped. We have teeth that are chipped in the front, and people want those.
These are little things that can make a big difference. I mean, you must,
Right.
as a dentist, it drives you crazy. You're in the grocery store. You see people, they do their hair, their nails, they take care of their skin, and they have little things that can make a big difference.
Correct.
Do you see that all the time?
All the time, all the time. And just a little modifications of teeth, adding a little bit onto the teeth, correcting a chip, taking a tooth that's discolored. Some people just, the way their teeth are formed, they'll have discoloration in the teeth, especially in the front. And with those kind of patients, I mean, really basically we just want to take out the discoloration of the tooth and replace it with a natural tooth-colored
So some kind of a
restoration.
bond?
Like a bonding,
I mean,
yes.
they've tried bleaching trays, things like that, but they may have to go a step further.
Correct. And some of these patients, you mentioned whitening. All right, and whitening is something we use for when people in general want all their teeth to look better. All right, but then there's some people their teeth look better. They don't need necessarily the whitening, but they'll just have a few teeth that are discolored, and we can take care of that. Some people, the shape of their teeth isn't correct.
So what do? Sand them down?
In most cases, no, you don't sand them down. I mean, some rare cases you can just do some modifying or recontouring of the teeth, but in most cases you're going to have to most likely lengthen the teeth, or you're going to have to do something to bring it to its regular shape. Some people have what we call peg laterals. Peg laterals are the teeth on either side that when they're formed, they're not the regular size. So when that patient smiles, it looks like something's missing because two of their teeth are smaller. It looks like they have baby teeth there. Now with those people, you can do veneers on just those two teeth and bring those to normal size, and it makes the world of difference in their smile.
Let's start with veneers, becoming one of the most popular procedures. What's driving this?
I think the results. I think people are finding out now that how well they can look with veneers and how natural they are. You know, when you do veneers on someone, my goal is when you do a veneer that patient goes out and no one knows they have veneers.
Okay.
All right, but yet it creates a beautiful smile. Or you can do just individual teeth like I talked to before, like the peg laterals, and just create a beautiful smile in conjunction with the rest of the teeth.
With veneering, how have things changed in the past 10 years, 20 years?
They've changed quite a bit, Randy. They're thinner, they're stronger, they're more lifelike. The technology of putting them on is getting much better. The adhesive components that we use are much better. I mean, it used to be that we didn't really have the products to make them stay, to make them hold up to the forces.
What about that metal line, though, that I see around people's teeth? What's going on there?
Okay,
is that
the metal,
a bad veneer? What's happening?
That's not a veneer. That is actually a porcelain over metal crown. Now, back in the 80s, 70s, if you wanted to change someone in the front, you basically had to do full crowns on people. And full crowns had both a porcelain and then had metal underneath it. So that metal, you would see kind of a show-through with that metal, and you would especially see it right at the gum line. Also would make the teeth look grayer, kind of a grayish hue.
So what do you say to people out there that are watching this, that they have that gray line? I see it's very common. Can you fix just that area? Do you have to do everything? Could you go?
What you would have to do in that case is you would have to replace the crown and do an all porcelain crown or a veneer to replace it. If you did that, then you would take out the metal component and you wouldn't see that show through.
But that's an easy one for you to fix.
Absolutely.
Okay, so with veneers, what are misconceptions? Because anticipating this interview, I knew that I was going to interview you about veneers, and I'm hearing things like big teeth, unnatural look. It's a fear of having the big teeth. How do you avoid that?
Well, I think it all comes into how you design the case and how you get the teeth ready to make the veneers.
So that's in the hands of the dentist?
That's in the hands of the dentist, yes. I mean, if you were just to take and slap veneers on someone's teeth that we're trying to change the crowding situation, we're trying to change almost like an instant orthodontic case, you're going to have to do some way of where you're going to make these veneers thinner. So you might take a little bit off on the front of the tooth that maybe it's sticking out more. You might take a little bit off the tooth that's sticking back too much and find a happy medium in between. But that's how you avoid the thick teeth syndrome. That's why when you design the case and you actually prepare the teeth for the veneers, you have to keep that in mind before you do it. You can't just put veneers on the front of the teeth and expect them not to be thick.
That's happening every day. Is that poor training? I mean, not everybody has had specialized training, gone to the Las Vegas Institute, and things like that. I mean, why is it happening, though? Because it happens. In fact, a physician, friend of mine, it affected his speech. It still affects his speech to this day. Very unnatural.
Well, I think that, yeah, it is a function of training. If a dentist goes out and tries to do a full smile design case and hasn't had proper training, basically what they're going off is just what the manufacturer told them how to make their veneer.
So a general dentist can go and take a weekend course and call themselves a cosmetic dentist. Is that correct?
Well, I think you'll see a lot of, there's some probably dentists out there that haven't even taken a weekend course and then call themselves a cosmetic dentist. I mean, cosmetic dentist, there is no, quote, specialty in cosmetic.
It's not a recognized specialty.
That is correct.
But you specialize in cosmetic dentistry.
Right, right. So, you know, the example you just gave a second ago about your friend who said they had a problem with speech, that can be worked out when you're doing the case. We worked that out, and I found that out through continuing ed and Las Vegas Aesthetics I went to, and Pacific Aesthetic Continuum in San Francisco, that can be worked out in your temporary phase. Because what we're trying to do is, if a patient can't tolerate your temporaries, and I make my temporaries look exactly the same size as what your regular teeth are going to look like when we're done. So it's almost like a try-in phase. You can wear the temporaries, and over the period of time we're waiting to have actually the veneers made, you actually try them out. This problem with speech, I'm not going to say...
Usually will come up in the temporary phase.
It will come up in the temporary phase. Although, there are cases, if you're doing instant orthodontic cases, if you're doing those...
And what does that mean, by the way, instant orthodontic? Somebody comes in with crooked teeth, you put veneers on and they're straight?
Correct, correct. You have patients that come in and maybe they don't want to go through orthodontics. I mean, orthodontics is a year, 2 years to get finished. I can do the case in 2 visits. So some people want to get it done quicker. So we call it, I guess that's how I got coined, instant orthodontics.
Dr. Davenport, we're going to take a quick break. We come back, I want you to take me through the process from the consultation to the design, the labs, their temporaries, all of that stuff.
Sure.
You're watching The Wellness Hour. I'm Randy Alvarez. We're talking to cosmetic dentist Dr. Davenport about how to make your smile look natural and beautiful. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We're talking to cosmetic dentist Dr. Davenport about the latest advancements that have been made in cosmetic dentistry. Dr. Davenport, before we move into these before and after photos, your work,
sure.
Take me through the veneering process. What can somebody expect to go through?
Well, initially, when someone comes to my office, what we're doing is we're just taking a good look and finding out what their expectations are. What is it they don't like about their smile?
By the way, do you meet with them one-on-one, or is this a technician?
Oh, yes, I do. I meet with them one-on-one. We take digital pictures of them, close-up pictures of their smile, and we take a look and see, well, what is it that you actually want to change? Because they're the ones that run the engine. They tell us what they want, and we try to deliver what they want.
Are you showing them photos of what's possible? What are you doing? Clay models?
Well, what we could do is, I mean, one thing we could do is we take a picture of their smile and actually image them. Image them, we have special software where we can take a picture of their face, image them, and then show what their smile would look like in a digital photograph.
Okay.
Put that side by side, and that kind of gives them an idea
of what they look like. And that's pretty accurate.
That's pretty accurate, but usually we're going to deliver much more than that. The digital imaging does help, kind of gives them an idea, but we usually deliver better than what we can do with the imaging software itself. Now, we also take models of their teeth and try to decide how we're going to do this. I can even send the models out to my specialized lab, and they can send back a waxed up version where we can look at it and say, hey, this is what your smile looked like afterwards. You know, you mentioned earlier, you said, well, you know, how thick is this going to be?
Yeah, this big teeth look.
Right. They can actually look at it. They can see, well, gee, how things are going to change when we change these teeth. But anyway, initially, we're just looking at them. We're doing that. It's just a fact-finding mission the first time they come in.
Okay.
Now, as far as after that, you know, if we decide that we're going to go on with this case and they're going to go on and get this beautiful smile,
sure.
Then what I'm going to do is I'm going to send these models for sure. I'm going to send them back, send them out to my specialized lab, and they're going to look at them, and we're going to decide exactly how we're going to make these teeth and exactly what I'm going to have to do when they come in next time to get them ready to have those teeth made. So it's actually like, I would say, like a 3-part procedure.
So after the prep, they have temporaries.
Yeah.
Tell me about these temporaries. Do they look real?
Oh, absolutely. Look, I mean, I get so many compliments on my temporaries where people will leave. I mean, people have been going through for a long time, maybe their whole life, with bad-looking teeth.
Okay.
And they come in here, and now, because my temporaries are based on what we're going to take them to.
So they know what their smile is going to look like in advance.
That is correct. When they leave the office the day that we prepare their teeth, take their impressions, and we make their temporaries, now all of a sudden they have temporaries that look like their veneers are going to look. Right. So they've already made the big jump and left, and a lot of people will say, wow, you know, fantastic. I mean, I never looked this good, and they're still only in the temporary phase.
So what is the lag time then where they get the permanent veneers or the veneers?
Well, in my office, it's a month.
Okay.
So, and there's a reason for that. I mean, I send my cases out to some of the best labs in the country, and by doing that, we have to allow the ceramist enough time to make the case perfect. We can't be sending it out and getting it back in a couple weeks.
So not all labs are the same. That's another thing we discussed over the telephone.
No lab.
What do you mean by that?
There are labs out there that specialize only in this. I mean, they are fantastic.
They're artists?
Oh, absolutely. I mean, the ceramists that we use are definitely artists. I mean, we're not using just somebody who just makes porcelain just to fit on the teeth. I mean, every single increment of doing the veneer process is complicated. We're trying to make it look as lifelike as we can. So
there are cheaper labs out there?
Absolutely, there are cheaper labs out there.
Okay.
I found this out actually by going when I went on and did other studies elsewhere, like Las Vegas and San Francisco. That's where I met some of these labs. And then
you realize that the lab is an important
and the lab
part of the
is an important thing. I can do everything right, but if I don't have a good ceramist that's actually doing the veneer, my case is not going to come out as good.
So that could be the difference between a natural-looking smile and that big teeth look, or a phony look. Phony-looking tooth.
Yeah, absolutely.
And these teeth look real.
Absolutely, they look real. Yeah, they look real. I mean, I've had patients who have had veneers done and didn't tell anybody. People that we've done subtle changes on, not big changes. Obviously, if I do a big smile design case, like some of the ones you see here, people are going to notice, going to take notice and probably figure out, well, something had to be done with your smile. But I have some people that have little things that are wrong, and they just don't like it. We do the veneers, they come out, they won't even tell anybody. People will come up to them and say, well, you know, it's like something's different about you, but they don't know what it is.
You're convinced, though, that the smile makes a huge difference in somebody's life, their self-esteem.
Absolutely.
All those things.
Oh, yes. Yeah. I mean, let's face it, in life, we're always trying to sell ourselves. I mean, between you and me, if I'm having a conversation with you and I'm trying to get a point across, a smile projects, I think, a positive outlook on life. You know, you're more upbeat.
I know people that hide their smiles. They're not happy with their teeth.
That's correct.
They smile with their mouth closed.
That is correct. That is correct. But I'll guarantee you this, if they had a smile design case and had veneers done, they'd be smiling like crazy. And I've seen that actually.
Now, with our society sometimes, and I looked at some of your photos
on
the break.
Yes.
And after their teeth are fixed, they look like a different person. There's a perceived intelligence there. They look like a different person afterwards. They even look younger, brighter, everything about it.
Absolutely.
Do they report this to you, though? Do they say they have this feeling of self-confidence?
Yes, I've had people report that to me and say that, you know, I feel much more confident now talking in the public. I mean, we found that some of the people who want this done are people in business, people that are saying that, hey, you know, let's face it, in this world, if you can get an extra edge anywhere, you want to get it. And in business, if I'm having a conversation with you, then I'm going to get an extra edge, I think, if I have a beautiful smile. It's not even just be the smile. It's not just, it's just not that because you smile better, then your presentation's better, but you project more confidence, you have more self-esteem. You know, someone who can't smile, they're losing that component.
Dr. Davenport, we're going to take a quick break. We come back, I promise we're going to get to these photos.
Okay.
You're watching The Wellness Hour. I'm Randy Alvarez. We're talking to the cosmetic dentist that everyone seems to be talking about because of the results he's getting with his patients, Dr. Davenport. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Davenport, cosmetic dentist, talking about the latest advancements that have been made in cosmetic dentistry. Dr. Davenport, we're talking about veneers. Show me some of your work.
Okay, Randy. This young man came to me at the end of high school.
Okay.
And he had just had braces done, and his mom came in, and we wanted to have this one tooth replaced. one tooth replaced that that tooth never formed. He had a birth defect.
Okay.
All right. Here's a close-up. Here's a close-up picture.
Now this is a young guy, had braces. Teeth look okay. Look okay to me.
Yeah. Well, he had a lot of problems with the rest of his teeth, in that he had a lot of discolorations in all his teeth. So to replace his one tooth, it would have been very difficult actually to match the other teeth that we had there.
Okay.
I suggested that we do a whole smile design case on him, and after talking to his mom and dad, that's what we decided to do, and it just made an abundant difference in the way he ended up looking.
So you decided to do veneers?
We decided to do veneers. You know, now early on when we did this, it took a lot for him to smile like this.
Okay.
You know,
he didn't want to smile like that.
No, he really didn't want to smile. You know, he didn't smile. I mean, his mom even told me that, you know, he just doesn't smile. And he hasn't smiled. He'd had this problem, you know, from the get-go. So most of his life, he just really didn't smile.
Really? Okay.
So anyway, so we ended up doing a veneer case. We did the front 10 teeth to replace that tooth and ended up making a big difference. And this is what he looked like after we're done.
Huge difference.
So this is the before and this is the after. You know.
And what about smiling afterwards? I mean, what his parents, what did they say? I mean, this is a guy that didn't want to smile. Does he smile now?
Oh, absolutely. In fact, we alluded to earlier about the temporaries. I got a call that night thanking me from his mother, just saying that she never saw a guy smile so much. He came home and all of a sudden he was already smiling because he had his temporaries. So it made a huge difference in his life. And you see him today, he's smiling. You know, where before he wasn't. So this is a case of someone that's very young that had something done. I mean, veneers aren't just for the young people. I mean, it's for all ages.
For the sake of time, we're going to have to go on to the others.
Sure.
Because you have some great work here.
Sure. This young lady came into my practice. She is early 20s, but not a very feminine smile. Her teeth are worn down. She has some spacing, and it really bothered her. It really bothered her, and that's why she wanted to have something done. So this is a close-up picture of her teeth.
I mean, the teeth are straight.
The teeth are pretty straight.
Just not the most attractive smile.
This looks like someone who's 45, 50 years old. Now, we decided to do a complete smile design case on her, and this was the result that we ended up with.
Unbelievable difference.
Very more feminine smile. And someone like this, early 20s, I mean, I don't think anybody's going to know that she had veneers done.
Right.
But look at the change. I think just looking at the change in the eyes and everything else in this picture, that it just has more of a sparkle.
Yeah, when you look at the after, you wouldn't think of a person that just had veneers. They don't look like veneers. The gums all match. And then when you look at the before, I mean, it's just a complete difference. I mean, she even looks more intelligent in the after photo. I hate to say that, but there's a complete different perception about who she is.
I agree with you completely.
What did she say, by the way? She was thrilled?
She was ecstatic. She was ecstatic.
And this is something you can do fairly quickly, in a month.
Yes,
One month later, she looks like this.
That is correct.
Okay, what about this guy? Moving on to the next photo.
This guy's in his mid-30s. He's not happy with his smile. He's missing a tooth. He has a big gap between his two front teeth.
A lot of unevenness.
A lot of unevenness.
And that looks like it would take years to fix.
Right. But this is a case of instant orthodontics. Well, we can get rid of the gaps, plus we can lengthen these teeth, make them better looking, get rid of the chips, and this is his final result.
Totally different guy.
Totally different guy.
Completely different guy. Absolutely natural.
This guy didn't, and this is another case, this guy did not want to smile. With the teeth that he had before, now he comes in our office, he's always smiling.
Now you look very proud of your work.
Oh, absolutely, I'm proud of my work.
Is this what drives you, the results here?
You know, this is the greatest satisfaction I get out of dentistry. I mean, people come in and you're giving something that they really want. You know, the other stuff that we did in the past, and we still have to do that. We still have to do fillings and fix people up. But this is something that people actually, they want the result. They're happy to get it done. So
I mean, that makes me look like the same guy. If we put those side by side, this is a guy that went from, I mean, this is an extreme makeover. And
sure.
All you did was fix his smile. Time for a couple more.
Okay, this guy is in his mid-40s, and he was unhappy with his smile. He actually has, if you look at a close-up of his teeth, what we call a reverse smile. His teeth go this way instead of following the lower contour of his lip. All right. He had a lot of crowding in his bottom teeth. His bottom teeth bothered him as well. So in this case, we end up doing the upper 10 teeth and the lower 10 teeth.
All with veneers.
All with veneers. So we did 20 teeth on him, and this is the end-up result of this.
Complete difference.
Complete difference.
So what do these people say to you as a dentist? I mean, when they even get their temporaries, this guy, I mean, they must be blown away.
They are blown away. They are blown away. And they just, you know, one thing I hear is, I wish I had done this sooner. I wish I could have had this done earlier in my life instead of putting up with this for so long. But, you know, nowadays, because so much that we can do, you know, I just think people need to know that this is available to them. Here's another great one. Just shows that you don't have to be a 20-year-old and want a great smile. Now, this lady's had these teeth for all of her life, and she's always wanted to have them better looking. You know, you can see by the close-up that she's got teeth that are crossed over with each other. They're just not the right, not exactly a great shape. They look worn.
Not a bad smile, but it's a...
Not a bad smile. But you know what? This lady had been in my practice for years. And one day she came to me, and she, after talking to her husband, she said, you know, I would really like to have a better smile. So she talked to me about it, and we decided to do her case. It's an instant orthodontic case, like some of the other ones we showed. We're going to uncross those teeth. We're going to basically rejuvenate her smile, bring her back the way at least she looked when she was younger. Now, she actually is going to look better than when she's younger, because now she doesn't have these teeth that are misshaped or crossed over. Now look at the finish on this.
Wow.
You know, this made a big difference in her life.
She looks happier, younger, more energy. It's a completely different look.
Right. And, you know, she isn't alone here. I mean, there's other patients out there just like her. And they wonder, geez, if this could have been done years ago, they would have done it in a heartbeat.
With this woman that wishes she would have done this years before, there's other people out there. They have fears and hesitation.
Correct.
What do they tell you? What are these common fears?
Well, I think it's the fear of the unknown. They don't know what's going to happen. They don't know what they're going to look like afterwards. And they're really not sure if they should have something like this done.
Because these are natural-looking teeth.
These are,
When I look at these afters, it doesn't look like dental work.
Correct, correct. And as I alluded to earlier, I have patients that basically have had veneers done and won't tell anybody because they don't want people to know they have veneers, but they're natural looking.
Final message. We're completely out of time. What do you
Sure.
want people to know about what you do as a dentist and about your practice?
Well, one thing I want you to know, or people to know, is this isn't the only thing that I do. This is one of my passions, and I love to do that, but I'm a general dentist also. So, I mean, we do other cosmetic procedures. We do whitening. You can do whitening in our office. You can do take-home tray whitening. We do about all the services that you would get at a general dentist. Implants, restorative. We do metal-free dentistry. I mean, I don't do...
A lot of people with metal throughout their mouth, all of these old amalgam films.
These old amalgams, and you know, we haven't done amalgams in our practice since 1998. All we do is natural tooth-colored restorations. And
what about friendly staff? Because we talked about them. You have a great environment, you say.
I've got a great staff. I think if you come to my office, it's like going to a friend's place. I mean, we treat everybody like friends. We get to know you as a person. And I'd like to invite anybody who maybe saw this show and has an interest in maybe, whether it just be regular dentistry, a few things, or even a complete smile makeover like this, that they come to my office.
We're out of time. Thank you so much for coming on the show. Very interesting.
Thank you, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.